5 main skills you will learn in this lesson. You will learn how to identify the normal and abnormal gestational sac, evaluate fetal cardiac activity, identify the signs of complete and incomplete miscarriage, identify the signs of a molar pregnancy, and perform the appropriate ultrasound follow-up. Pelvic pain and vaginal bleeding are common symptoms in early pregnancy, but they don't always mean the pregnancy is abnormal. There are several causes, but the cause may not be discovered. It can be difficult to determine the cause of pain or bleeding by only physical examination. There can be many causes, and pelvic ultrasound can be very useful in diagnosing some conditions. Conditions that can be diagnosed by ultrasound include normal pregnancy, blighted ovum, fetal demise, miscarriage, molar pregnancy, and ectopic pregnancy. Ectopic pregnancy will be discussed in the next lecture. Our first step after clinical exam is to determine if the pregnancy is normal. This is important because some patients with an abnormal pregnancy will require treatment at a hospital. In the first trimester, we may see 3 possibilities: an early normal intrauterine pregnancy, an abnormal intrauterine pregnancy, or the pseudogestational sac of an ectopic pregnancy. Sometimes a follow-up ultrasound is required to determine if the pregnancy is normal. Remember that there are findings we must see to confirm a normal pregnancy. First, we must see a normal gestational sac with a yolk sac or a fetal pole. It is very important to remember that a gestational sac without a yolk sac does not confirm a normal pregnancy. When you perform an ultrasound for bleeding or pain, you may identify a normal pregnancy. In this case, the patient can proceed with routine antenatal care and a repeat ultrasound at 18 to 22 weeks at your center. Why might a woman develop bleeding or pain in a normal pregnancy? Bleeding in a normal pregnancy is often caused by increased blood flow to the cervix. Pain is often felt when uterine ligaments get stretched. However, if you have any concerns about the patient, even though the ultrasound seems normal, send the patient to the hospital. If you see any of the following conditions, refer urgently to the referral hospital: 3rd trimester bleeding, an empty uterus with a large amount of free fluid around the uterus, an empty uterus with an adnexal mass, abnormal intrauterine fluid or tissue, a fetus with no cardiac activity, a gestational sac greater than 20 millimeters without a yolk sac, or a gestational sac greater than 25 millimeters without a fetal pole. If you see a gestational sac that is less than 20 millimeters without a yolk sac, repeat the ultrasound in 2 weeks. If no yolk sac or fetus is seen on the follow-up scan, send her to the referral hospital. Another condition we might determine with ultrasound is called blighted ovum. This is an abnormal pregnancy where the fetus never develops. The blighted ovum may continue to grow on follow-up ultrasounds 1 to 2 weeks later from hormonal stimulation, but no fetus or yolk sac will appear. Remember the signs of an abnormal gestational sac. A gestational sac is likely abnormal if the mean sac diameter is more than 20 millimeters and there is no yolk sac, or if the mean sac diameter is more than 25 millimeters and there is no fetus. Now let's review our previous lecture on mean sac diameter. Please pause the video now to ask participants to recall how the mean sac diameter is used and the steps to calculate a mean sac diameter. The mean sac diameter is used to estimate gestational age when you see a yolk sac but no fetal pole. To find the mean sac diameter, follow these steps. First, measure the greatest length, width, and height of the sac. Add these numbers and divide by 3. Then find the number in your handbook tables to calculate the gestational age. You can also find these tables on our website at tinyurl.com/UW ultrasound. This is a transverse image. Notice the caliper positions here to measure the gestational sac. The calipers are measuring only the hypoechoic fluid-filled gestational sac and not the echogenic material around the sac. In the bottom left corner, we can see the measurements for height and width are 1.6 and 1.4 centimeters. This is a sagittal image of the same uterus. In the bottom corner, we can see this gestational sac is 1.3 centimeters in length. When we add the three measurements together and divide by 3, our mean sac diameter is about 1.4 centimeters or 14 millimeters. Again, in most cases, the machine will calculate this for you. If this sac were larger than 20 millimeters, without a yolk sac, it would likely be a blighted ovum or a failed pregnancy. These are two different cases of a blighted ovum. In both cases, the gestational sac measures more than 20 millimeters but does not contain a yolk sac. This is abnormal. The fetus will not develop in these pregnancies, but the sac may continue to slowly grow for some time. In this case, the gestational sac is greater than 25 millimeters, contains a yolk sac, but has no fetus. This is abnormal, even though we can see a fetal membrane. Here we have labeled the yolk sac and fetal membrane to make them more obvious. Remember these guidelines. Refer urgently to the referral hospital if the mean sac diameter is greater than 20 millimeters without a yolk sac, or if the mean sac diameter is greater than 25 millimeters without a fetal pole. This indicates an abnormal pregnancy and could be an ectopic pregnancy. If you see a gestational sac less than 20 millimeters without a yolk sac, rescan at your health center in 2 weeks. If a yolk sac is still not seen, refer urgently to the referral hospital. It is